I'm going to do the room scan. Hello, my name is Sirapon. I'm the recorder.
Alright, I'm going to knock on patient's door. Hello, my name is Shpresa. I'm a student nurse from Marine Valley, and I'll be performing a head-to-toe assessment on you today. Is that okay? Yes? Perfect. And for this assessment, I will be touching you. Is that alright? Perfect. I'm just going to ask my patient for the name and birthday. Carl Shapiro, July 19, XX. Perfect. I'm just going to look at my patient, and my patient looks his stated age of 54 years old. He is smiling, looks happy. He shows no signs of distress, and his behavior is calm, which is good. Next, I'm going to look at my patient. I'm going to assess my patient's level of orientation. So I'm going to ask my patient, do you know what month it is? December? Perfect. Do you know where you are? Marine Valley Hospital? Perfect. And do you know why you're here? For pain? All right. Patient is alert or oriented to person, place, time, situation. And their speech is clear. Next, I'm going to assess my patient's groom and hygiene. And their hair is nicely groomed back. Their hygiene is good. They have bathed, they have a fresh gown on, and they smell fresh. Position, the patient is in position in bed, is midline. They are not slumped over. Their mobility to get in and out is good. They do not use any assistive devices, and they have no involuntary movements. And their body is symmetrical from the right and to the left, which is good. Next, I'm going to do my patient's vitals. So I'm going to lower the bed rail. I'm going to expose the patient's chest to the apical pulse. And to locate the apical pulse, it's on the left side of the sternum, 5th intercostal space, mid-clavicular line. And I'm going to auscultate for 1 full minute and take a listen. Alright, left side, 5th intercostal, mid-clavicular line. And that was at 60 beats per minute, regular rhythm. And then 2+4, which is good. Next, we're going to move down to the radial pulses, which are located on the side of the wrist. And we're going to take a listen for 30 seconds times 2 or a full minute if we feel any arrhythmias. And those were at 60 beats per minute, regular rhythm, and at 2+4, which is good. Next, we're going to check my patient's respirations, and we're going to do this for 30 seconds times 2 or 1 full minute. And those were at 16 breaths per minute, regular rhythm, which is good. Normal pulse range is 60 to 100, and a normal respiration range is 12 to 20. Next, I'm going to check my patient's O2 level on their pulse ox, and it was at 98% on room air, which is good. Normal range is 95 to 100. Next, I'm going to do the blood pressure, which is located on his other arm. And I'm going to place the cuff on his upper arm. I'm going to locate the brachial artery, which is on the inner part of their arm, and I'm going to pump the cuff up. And I'll be listening for a systolic and diastolic value. And I'm going to place the stethoscope on their brachial artery. I'm going to pump the cuff. And it was at 120/80, which is a perfect blood pressure. Next, I'll be taking temperature. And I've taken an oral temperature, and it was at 97.6 degrees Fahrenheit, which is good. I would now do an oral temperature if they have anything hot or cold to drink, or if they were unable to fully close their mouth. I would do a tympanic temperature. Unless they have any earaches or any drainage, I would not use it. I would do a rectal temperature if a doctor had ordered for a very accurate temperature. And I would do an axillary temperature if oral was not available. But I would not do an axillary temperature if they were unable to fully close their armpit. Alright. Next, I'm going to move to the head. I'm going to inspect the overall head shape, and it is good. I'm going to inspect the facial features to see if they're symmetrical, and the right side is symmetrical to the left side, which is good. I'm going to inspect the scalp for any lesions or any dandruff, and there is none present. The hair is in good condition. It is also nicely groomed back. I'm going to assess the patient's face color, and it's good for the ethnicity. The patient's lip color is nice and pink, and the skin is intact. Full texture of the skin is intact, smooth, and there's no lesions presented, which is good. Next, I'm going to assess the patient's neck, and it is symmetrical. The trachea and substernal notch is midline, and the shoulders are even. Next, I'm going to do general palpations of the head for any masses or any tenderness, and there is none present. I'm going to palpate the carotid arteries one at a time to look for the pulse arteria. So I'm going to do the left side first, and that was at 2+4, and I'll do the right side, and that was also at 2+4, which is good. Next, I'm going to palpate the lymph nodes, starting at the preauricular lymph node, which is in front of the ear, So I'm gonna do the preauricular and run my fingers through it. Alright. Now I'm gonna do postauricular, which is behind the ears. I'll do postauricular. Good. I'm gonna do occipital, which is behind the head. So I'm gonna do occipital. Alright. Then I'm gonna do tonsillar. I'm gonna have my fingers in the V shape and do it along the neck, under the jaw. Tonsillar. Good. Now I'm gonna do submandibular. Submandibular, which is right under the jaw, and run my fingers. Submandibular. Then submental, right under the chin. Alright. Then I'm gonna locate the major muscle, and I'm gonna do interior cervical first. Interior cervical. Then I'm gonna do posterior cervical, which is on the opposite side. Posterior cervical. And that is good. Next, I'm gonna locate the clavicle and do supraclavicular and run my fingers. Supraclavicular. And that was good as well. So next, I'm going to do inspect the patient's eyes and inspect the patient's eyes. Position is midline. The pupils are in alignment. The eyelids are not drooping. Eyebrows are equal and symmetrical in shape. Next, I'm going to look at the lacrimal drainage, and there is no present of drainage or any tears. I'm going to pull down the lower eyelids to check the conjunctiva, and those are nice and pink. The sclera is nice and white, and the pupils are in the center of the irises, which is good. Next, I'm going to dim down the lights, and I'm going to perform the Perla test. And currently, the pupils are at a size 6, so I'm going to turn my pen light on and perform the test. Alright, pupils constricted from a size 6 to a size 4, which was good. Next, I'm going to have the patient focus on my pen, and I'm going to bring the pen towards their eyes. Alrighty, pupils were equal, round, reactive to light, and accommodating, which is good. Next, I'm going to perform the extraocular movement. So again, I'm going to have the patient focus on my pen light, and I'll be moving my pen light around. I'm going to have the patient follow the pen light without moving their head, just with their eyes. And I'll do it right now. Alright, patient was able to do that perfectly. Next, I'm going to move to the ears. So first, I'm going to palpate the auricle, and then I'll palpate the lobule and the tragus for any pain, and patient says there's no pain. I'm going to assess the ear canal for any drainage, and there is none present, and the ear is free from any lesions. Next, I'm going to test the patient's auditory acuity. So I'm going to cover their ear, or I'll have the patient cover their ear. I will take a step back and whisper a word and have them state the word I told them. So I'm going to say, Moraine. I'm going to ask the patient what I said. Moraine, perfect. Next, I'm going to move on to the other ear. And repeat the steps. So I'm going to palpate the auricle, the lobule, the tragus for any pain, and no pain was present. Check the ear canal for any drainage, and there's none. And check the overall ear for any lesions, and there's none present. Again, I'm going to check the auditory acuity by having them close this ear, taking a step back, and whispering a word, and this time I'll say, nurse. And I'll ask the patient what I said. Nurse, perfect. Patient was able to hear during the whisper test. Also, patient's hearing is good through conversation. They're able to follow directions and communicate back to me, which is good. Next, I'm going to check the patient's nose. So I'm going to have the patient close one nose at a time to check for patency and flaring. And they're able to do that perfectly. There's no obstructions or flaring. Next, I'm going to check for septal deviation and the mucous membrane. And the mucous membrane is nice and pink and moist, and the septal deviation is good, intact. And both nostrils, both nares are equal in size. Next, I'm going to be checking the mouth. I see that all teeth are intact, and the gums are free from any lesions and wounds, which is good. The sublingual mucosa and the buccal mucosa are nice, pink, and moist and healthy. I see that the hard palate and soft palate are intact. I'm going to have the patient say ah and use a tongue depressor to see the uvula. So I'm going to put my tongue depressor. Please say ah. Our uvula is a midline, teardrop shaped and smooth, and the tonsils owing in the back are equal in size. They are not enlarged. And the patient has no missing teeth, no decay, and they do not have any dentures, which is good. Next, I'm going to have the patient do active range of motion of the neck. So I'm going to have them turn their head towards me and to the other side. Good. And I'm going to have the patient look up with their neck and down, which is good. Patient has full range of motion. Next, I'm going to perform the resistance test. So I'm going to lay my palm on their cheek, and I'm going to have them turn the other way while my hand has some resistance. Perfect. And perfect. Patient has good resistance. Next, I'm going to be moving down, and I see that my patient is breathing through their nose. Do not use any accessory organs or muscles such as their stomach, their ribs, or their shoulders to breathe. They have no retractions as well. I'm going to test for my patients if they have any JVD, which is jugular vein distension. And by doing so, I'm going to have the bed laid flat and raise it up to a 95-degree angle. And if there's any masses or bulges that go away, the patient does not have any JVD, which is jugular vein distension, and my patient does not have any. My patient is able to breathe easily in supine, prone, and upright, which is good. Patient does not have any cough or sputum present, and the overall symmetry of the chest and the chest configuration and shape is symmetrical and equal and normal for their body type, normal shape for their body type, which is good. Next, I'm going to inspect the upper extremities and lower extremities for the color, for hair pattern, and any deformities. And the color is good for patient's ethnicity. There's normal hair pattern on all the extremities, and there's no deformities, which is good. Next, I'm going to assess the patient's fingernails and toenails for condition and for capillary refill. So I'm going to start with this hand, and I'm going to squeeze each finger and assess for capillary refill. And it was less than 3 seconds, which was good, and the condition of the nails are good, and they're nice and pink. Next, I'm going to move on to the toes. I'm going to do each toe. And again, it was less than 3 seconds, and the condition is good, pink. And I'll do the last hand by pressing each fingernail. Capillary refill was less than 3 seconds. The condition is good, and they are nice and pink in color, which is good. Next, I'm going to move down to the chest. So I'm going to expose the chest. I'm going to palpate the chest anteriorly, laterally, and posteriorly for any masses, tenderness, or crepitus. So I'm going to do light palpations along the chest. Alright, and there was none present. Then I'm going to palpate the 5 cardiac landmarks for any heaves or lifts. So we're going to start at the aortic, which is second intercostal space, right side of the sternum. And move on to pulmonic, which is second intercostal space, left side of the sternum. Go to Erb's point, which is third intercostal space, left side of the sternum. And then we're going to go to tricuspid, which is fourth intercostal space, left side of the sternum. And then we're going to go to mitral, which is fifth intercostal space, left side of the sternum, mid-clavicular line. And we're going to palpate that. And the patient has no heaves or lifts presented, which is good. Next, I'm going to check the patient's chest expansion and depth. So I'm going to have my hands on their chest. I'm going to have them take a deep breath in. Perfect. My hands equally, symmetrically separated, and the patient has normal depth during expansion. Next, I'm going to auscultate the lungs, the 5 lung lobes. There's 3 on the right and 2 on the left, and I'm also going to listen for the lung sounds. And I'll be using the ladder technique, and I'm going to be starting above the clavicle. And every time my stethoscope touches your skin, can you please take a deep breath for me? Thank you. I'm going to start above the clavicle. Take a deep breath. Good. I'll move across. Good. Move down. Good. Across. Down. Across. Down. Across. Down. Across. And laterally. Alright, lung sounds were clear anteriorly, posteriorly, and laterally. Next, I'm going to auscultate the heart. So we're going to start at the aortic, which is second intercostal space, right side of the sternum. Good. Then we're going to do the pulmonic, which is left side of the sternum, second intercostal space. Good. Try Erb's point, which is third intercostal space, left side of the sternum. Good. Tricuspid, fourth intercostal space, left side of the sternum. Good. And then we're going to do the mitral, which is fifth intercostal space, left side of the sternum, mid-clavicular line. And the heart sounds are good. Next, I'm going to raise the patient's gown, and we're going to palpate the peripheral pulses. So we're going to do the radial pulses, which are located by the wrist, and they were at 2+ force. Next, we're going to raise the gown up and do the femoral pulses, which is by the groin, and those were at 2+ force. We're going to go to the popliteal and feel for those, 2+ force, and 2+ force for the other one. Next, we're going to go to the pedial pulses, and those are at 2 plus force, and posterior tibial, and those are at 2 plus force as well, which is good. On touching the upper and lower extremities, all extremities are warm to touch. Next, we're gonna move to the abdomen, so I'm gonna lower the gown again, and I'm going to inspect the abdomen for contour and symmetry, and it is equal and flat. Patient's pigmentation is even throughout, and the color is good for patient's ethnicity. There is no strays or scars, there's no pulsations, there's no bulges or masses, there's no petechiae present, which is good. And umbilicus is in midline. Next, we're going to auscultate each quadrant for 1 full minute to listen for active bowel sounds. And if we hear none or less than 5, we're going to auscultate for an additional 4 minutes. So we're going to start on the right upper quadrant, and I got 15 active bowel sounds. We're going to go to the left upper quadrant, 15, left lower quadrant, 15, and the right lower quadrant. And there was 15 active bowel sounds. So patient has normal active bowel sounds in all 4 quadrants, which is good. Next, we're going to do light palpations of the 4 quadrants for any masses, tenderness, or pulsations. So we're going to start on the right upper, good, left upper, good, left lower, good, and right lower, and good. There was no masses, tenderness, or pulsations and the abdomen. Next, we're going to move on to the genitals. So we're going to raise the gown, and we're going to inspect the tissue, the skin, any lesions, and discharge. So on inspection, the skin color is good for patient's ethnicity. The tissue looks healthy, there is no lesions, and there is no discharge present, which is good. Patient's urine is yellow and clear, and stool is brown and formed, which is good. Next, I'm going to look at my patient's overall color of skin, and it is nice color for the patient's ethnicity, and the skin texture is nice. It is not dry, it is not flaky, it is also intact, which is good. Next, I'm going to perform the gait test to see how my patient's walk is. So I'm going to have them get out of bed and walk around. And I'm going to look for any spasticity, any tremors, any tics, or any unevenness. And my patient's gait is good. Next, I'm going to test for the Romberg test, which is their balance. So I'm going to have them come out, stand up, and close their eyes. And my patient's balance is good. Next, I'm going to palpate the upper and lower extremities for muscle tone, joint shape, any tenderness, masses, or any edema or any pitting edema. So I'm going to start over here. The muscle joint is good. There is no edema, there's no masses or any tenderness, and tone, muscle tone is strong. I'll do the lower extremity. Joint shape is good. No pitting edema. Joint shape is good, and muscle tone. And I'm going to do the other extremity. Joint shape is good, no edema, muscle tone strong, no tenderness or any masses present. Joint shape is good, no masses, no tenderness, muscle tone is strong as well, which is good. Next, I'm going to perform the soft and sharp sensation test. So I do have a cotton ball as my soft and a toothpick tip end for the sharp, and I have the patient close their eyes, and I'm going to tap their extremities and have them determine which one they felt. So can you please close your eyes for me? Thank you. And you just tell me what you feel. Soft, good. Sharp, good. Soft, good. Sharp, good. Patient was able to determine soft from sharp, which is good. Next, I'm going to perform the strength test of the upper extremities. So I'm going to have them squeeze my fingers. Alright, their strength was strong and equal on both sides. And I'll do the lower extremities. I'm going to have them push down on my hand as a gas pedal. Good. And raise their toes to the sky. Good. Strength was strong and equal on both sides. Next, I'm going to do range of motion of the upper extremities. So I will demonstrate to the patient and have them demonstrate it back to me. So I'm going to do flexion, extension, supination, pronation, abduction, adduction, and circumduction. Thank you. I'm going to ask the patient if they need anything from me before I leave, because we have completed a full head to toe assessment. And they say they don't. I'm going to give the patient a call light and a reach to ring if they need anything. I'm going to raise the bed rail, and then I'll just foam out.